Good afternoon, everyone. Welcome to today's Indian sessions. That is Indian Psychiatric Society South Zone and NIMHANS Digital Initiative for Academics and Nurturing Skills. Today, we have psychiatric care during pandemics, a panel discussion. Now, moving on to the next, another important topic, another hot topic of today about personal protective equipments and what are these and how to wear them. There are many people who are asking what can be used at this time. So, we have Dr. Harihara Suchandra with us who would be explaining about these things. Welcome, Dr. Harihara Suchandra.
Hello, sir. Good afternoon. Good afternoon to all participants too.
Dr. Suchandra, what are these personal protective equipments?
Yes, sir. So now I'll be explaining about personal protective equipment. So first, what is a PPE? So any equipment which is intended to be worn by a person at work and which protects him against risks to his health is called a personal protective equipment. So for example, it could be safety helmet, it could be gloves, goggles, visors, overall, or a safety footwear. So to keep it simple, while riding a motorcycle, if you wear a helmet, it is also called as a PPE. While doing welding works, wearing visors is also considered as a PPE. So what is the main objective of wearing PPE is to prevent the transfer of hazardous material or infection from victims or the environment to healthcare workers. So this is the main objective of wearing a PPE equipment. So we know that based on the type of hazardous material or the infection, we choose what kind of PPE kits we should wear. So we are also aware of previous HIV kits and Ebola PPE kits which were used during previous infections. So when it comes to COVID-19 PPE kit, the main objective of wearing a COVID-19 kit is to provide head-to-toe protection. So it has 6 different things. First is gloves, overall, goggles, visors, N95 mask, and shoe covers. These are the different things which are available in a Corona kit. So here we could see some healthcare professionals wearing the COVID-19 kits. So the major question is, who should wear this PPE kit? So what the recommendations say is, the healthcare workers at high risk is supposed to wear a PPE kit, like the healthcare personnel who are working in an ICU or critical care units which deal with COVID-19 patients and patients who are severely ill and symptomatic, healthcare professionals who collect samples from COVID-19 cases, and personnel working with dead bodies and while conducting autopsies. So these are the healthcare professionals who are at high risk, and PPE kits are recommended to wear for these healthcare professionals. And for healthcare workers who are at moderate risk, for example, doctors who work in their OPD chambers, in triage areas, temperature recording stations, and registration counters, and waiting areas, it is considered to be moderate risk areas. And for those people, it is advised to wear N95 mask and hand gloves. So where does a psychiatrist stand? So we usually work in OPDs, inpatient setups, and triage areas. What is recommended for us is to wear an N95 mask and gloves. For example, if we are working in a COVID unit where COVID patients are admitted, so then it is recommended for us to use a PPE suit.
Dr. Suchandra, can you explain us how these PPEs are used, especially for COVID?
Yes, sir. I'll now share a video. There we would demonstrate how to wear a PPE suit. There I'll be explaining about donning and doffing of a PPE kit. Donning is how to wear a PPE suit, and doffing is how to remove a PPE suit. So we'll share a video where we have demonstrated how to don and doff a PPE suit.
Hello friends, I am Dr. Suchandra and he is Dr. Bhaskaran. We are currently working as senior residents in NIMHANS. Today, we will be demonstrating you how to use personal protective equipment. So, in every PPE kit, there are 6 things. First, hand gloves, N95 mask, goggles, visor, shoe cover, and overall. So friends, there is a particular procedure how to wear and remove a PPE kit. So wearing a PPE kit is called donning and removing a PPE kit is called doffing. So first we will be demonstrating you how to don a PPE kit and followed by doffing the PPE kit. There should be a particular designated area in each ward to don and doff a PPE kit. Before touching PPE kit, make sure that you wash your hands as per the WHO guidelines. Now we'll be demonstrating you how to don a PPE kit. First, you should wear shoe covers. Make sure your pants are tucked in shoe covers. So after wearing shoe covers, make sure you wash your hands again before touching any other PPE kit. After washing your hands again, then you have to wear overall. Now we will be showing you how to wear an overall. Here, what you have to understand is, it comes with a front opening and there is also a hoodie which comes with this kit. Next, you have to wear face mask. Goggles. Then visor. And finally, gloves. Make sure your handcuffs are tucked inside the gloves. So this is called donning of PPE kit. Let us go through this process again. First, you have to wash hands as given by the WHO guidelines. Then it is followed by wearing shoe covers first. Again, you have to wash your hands. Then you have to wear overall, followed by face mask, followed by goggles, followed by visor, and then finally you have to wear gloves. Before donning a PPE kit, make sure that you keep your belongings like watch, phone, wallet, ID cards outside. Now we will be explaining you how to doff a PPE kit. First, you should remove hand gloves. While removing hand gloves, make sure that your contact with outer surface is very less. So, you hold the inner part of the gloves and remove it till the fingertips. Then, with the same hand, try to touch the other gloves from inner part and remove it till the fingertips. Now, remove both the gloves and roll it like a ball and throw it in the red color dustbin. You have to wash your hands again. After hand wash, remove your visor, face mask, Now remove your overall. While removing your overall, make sure that you make less contact with the outer surface and try to remove it inside out, so that your contact with the outer surface, which is most exposed for infection, will be less. Then shoe covers. You have to hold it from inside and remove it inside out. You have to wash your hands again. While disposing PPE kit, hand gloves should be disposed into red color bins, while all other equipment of the PPE should be disposed into yellow color displays. Thank you friends, stay safe.
Thank you, Dr. Suchandra, bring us this video on which is the need of the hour. So this concludes the didactic sessions of the panelists. Dr. Prabha ma'am has had commented on a few really important aspects at this hour. Dr. Prabha ma'am, can I request you to kindly unmute your mic and tell the people about these, ma'am?
So basically I have mentioned that there's a strong need to develop ways of handling staff burnout and stress among our colleagues and our students, because I think all the frontline workers right now are very enthusiastic and trying their best to do things, but over time it's going to get more and more difficult, and like people say that this is a marathon and not a sprint, and I think that's what we need to ensure that everybody understands. So keeping the staff morale going is important, developing methods to get them to de-stress, trying to have daily debriefing meetings with the frontline staff especially, as a team, include the nurses and the doctors and the junior doctors. So I think these are some things that we are trying to see how we can develop, brief guidance notes for everybody to kind of make sure that the psychiatrists have a major role in some of this. I also think that there have been reports now of neuropsychiatric cases coming up, like I think somebody else had mentioned earlier, cases of delirium, encephalopathy. So, and these are not cases which are your classic respiratory conditions. So I think these are some of the things that we have to keep watching out and sensitizing people who are testing that these also may be variations of the condition, and not to sort of over time not to focus entirely on the kind of performer we have to work with at this point for testing. So thanks, Jim.
Thank you, ma'am. Dr. Senthil sir, are there any neuropsychiatric cases? Is there any surge of neuropsychiatric cases in this pandemic? What we have seen in emergency, sir?
Actually, in the last couple of days that we've had the few organic cases, it would be probably premature for me to say whether they are actually associated with the COVID infection, because obviously one was a CDA and one was another CNS issue, but nothing that per se. There was one in catatonia, and the catatonia was not clearly, the cause for the same wasn't determined. And another patient was there with, I think, a delirium, which is not related to substances. So obviously that, any of such scenarios that, the threshold for testing or suspicion is low. And so, tests are quickly sent out if needed, if warranted. Given that we can send that, or send the individual quickly over to Rajiv Gandhi and have them tested, or at least have their samples taken, and then subsequently the patient would only return after the tests come through. Depending on that, we would take, as of now, the presentations don't seem to indicate anything as of now, but it's still an early stage where we're at of this pandemic, like Professor Prabha Chandra had just mentioned. It's a marathon, not really a sprint. So we're going to probably come across more and more atypical presentations of the COVID, infection, neuropsychiatric aspects that would start emerging over the next couple of months, that more and more people would get more clarity on as the information gets streamed through. And then we would be probably much more prepared to try and understand and detect that in a timely manner and address it in the same way.
We also thank Linux Laboratories Chennai for their support through educational grant. Our YouTube channel is Nimans Indians. Kindly subscribe to the same